Hi, everybody. Faithy here from Smarty Nurse. I have something to share. I was playing with my AI, with my ChatGPT app on my phone, and I discovered this really lovely capability. All right, let's go. We're going to make a new chat. This is super cool. So, in the ChatGPT app, if you can see that very well, there is this nice little headphone device here. And what that does is it enables speech recognition, and then ChatGPT actually speaks back to you. And when I discovered that, I thought, oh my God, that's a great way to use my virtual patient prompt. You could actually practice teaching a patient, and it would be almost like in real time. You wouldn't have to pause to type anything. You wouldn't have to read what it said. It would just be like a back and forth. So I've preloaded this conversation that I had to test it out. I'm going to hit the headphones. It's connecting. It's connected. So let's continue talking about your new medications. Next, you're going to have a drug called panitumumab.
I don't understand what that means. Can you say it in a simpler way?
So just like your other medication, panitumumab is given intravenously, and it is used to combat colon cancer.
So like the Keytruda, the panitumumab is given through an IV and it helps fight colon cancer?
So my previous conversation was about Keytruda, and I'm like, well, Keytruda and Vectibix probably wouldn't be given together. But just to go with, something that's easy to educate about, I could talk about rash and how it works and different things. So that's basically how that works. Let's dive in and see how to set this up. So what I did was I copied my fancy prompt into ChatGPT on my computer, and I have ChatGPT on my telephone. And if you sign in with the same sign in, it will sync everything like pretty instantly. So there's my prompt. It's already said, so I take this medicine to feel better. I haven't started educating it yet, but you could do this straight from your phone as well. You can copy and paste into the ChatGPT, and then you're going to go to the upper right-hand corner where the little headphones are and just click on the headphones. So the name of your new medication is pembrolizumab. It's also called Keytruda.
I don't understand what that means.
Pretty cool, huh? Yes, so Keytruda is a drug that helps your body figure out how to fight the cancer better.
So Keytruda helps my body fight the cancer better?
Yes. One of the ways that cancer gets away with what it gets away with what it does, is that it fools your body into thinking it's normal cells. But it's not, it's cancer cells. So we are helping your body recognize that the cancer cells really are cancer and that it needs to get rid of them.
I'm worried this will change everything. What can I still do like before?
Well, very happily, most people have very few side effects from the Keytruda. It's also called pembrolizumab.
So I might not have many side effects from the Keytruda?
Yes, that is true.
Okay, thank you for explaining.
So it does have some side effects. It is kind of rare, but it can go a little bit overboard.
What are some of the side effects I should watch out for?
So it can go a little bit overboard and confuse your body, and it will think that there are normal parts of your body that it needs to fight against.
That sounds concerning. What should I do if I notice any unusual?
You should call your doctor right away if you have any unusual symptoms.
Got it. I'll make sure to call the doctor if anything unusual. Thank you for letting me know.
So your infusion will take 30 minutes to go in. It's given intravenously or IV, so we'll find a vein in your arm and we'll put a little tube in it and it will infuse through there. It takes about 30 minutes once we attach that to you, so it should take about an hour from start to finish during your visit here with us in the treatment room.
So during my visit, the infusion will take about 30 minutes to go in, and the whole process will take about an hour.
Yes. Do you have any questions for me?
No, I think I understand everything for now. Thank you for explaining everything to me.
Great. So I thought that was a really neat way to go through and make it a little bit more like having a conversation with a real person. So thanks for watching. I hope you enjoyed that little interaction. I thought it was super cool. If you have any questions or comments, please leave them in the comments below. If you enjoyed this video and want to see more like it, hit like and subscribe and, all the usual YouTube stuff.